Welcome to GLATA Member Spotlights. In this video series, we'll be speaking with athletic trainers across the GLATA region about who they are, their work setting, and the challenges they face. Before I introduce our guest, if you like the content we're putting out, please remember to like, comment, and subscribe to the channel, and follow GLATA on social media.
My name is Austin Hills. I'm a licensed athletic trainer in the state of Minnesota and North Dakota. I'm a certified athletic trainer, and I have a master's in advanced athletic training.
And tell me what school you're at.
I'm at Minnesota State University, Morgan. What got me interested in athletic training originally, when I was going to school, I knew I wanted to do something in the medical field, and orthopedics and sports medicine was an area that I had a interest in. The one thing I think that influenced me into deciding to go into athletic training, one unique thing I think about athletic trainers is our immersion in our patient population. We have a lot of access to our athletes on a daily basis. And I think that that allows us to have a lot more influence on their effectiveness and rate of rehabilitation with injuries. So I think that that was something that drew me to athletic training, being able to provide that daily care and make a positive impact on a daily basis is really important to me. So in the past 4 years that I've been certified as an athletic trainer, I think the highlight of my career was actually, it sounds kind of counterintuitive, but COVID year. I think that during COVID, during that 2 year period between 2020 and 2022, we had a lot of challenges and new protocols and procedures that we had to follow. And I think that myself and my colleagues handled it very well and were very adaptive to the situation. I think that that was super cool to be a part of and experience, something very different and unique to the world at that time. As a healthcare provider, it affected a lot of people, and I think that being able to adapt to those situations just proves how effective that athletic trainers can be as healthcare providers. I think specifically in athletic training, an area that I'm passionate about is rehabilitation and specifically post-surgical rehabilitation. I find that sometimes those cases, to me especially, can be extremely rewarding. Getting to work with an athlete from the day out of surgery to return to play and getting back onto the field or onto the court. I find it really rewarding, and I have a passion for being a support system for that individual, keeping them motivated on a day-to-day basis, tracking their progression, setting goals, and keeping that athlete positive and motivated to do the work to get back on the field. Yeah, I have gotten some advanced skills in Graston technique, kinesio tape practitioner, as well as emergency medicine. On top of that, I plan to pursue a dry needling course this summer to advance my skills in different modalities and rehabs that involve more fascial correction and things like that. Besides advanced techniques, I also really think it's an emerging thing is social media, being able to get influence from other sports medicine clinicians, physical therapists, chiropractic specialists, just being able to have access to a world of different techniques and philosophies around rehab is really important. And I think it's something that's emerging at this time, and we have a lot more access than ever before. And I think that that's been really beneficial in providing a rehab protocol or progressing rehab to different levels as needed. I would say one of my biggest mentors in my undergraduate degree, especially, was athletic trainer by the name of Jimmy Morin. Shout out to Jimmy. He was a really effective preceptor. I learned a lot from him, and it was in a period of time where I was really just getting to know the profession, and I got to learn a lot about the importance of patient relations and providing appropriate care and really getting to know my patients on a personal level and making them feel comfortable and confident in my abilities. Again, he was an individual that was, extremely bubbly, very different from my character, and I learned a lot of helpful tools as to, you know, interpersonal communication and patient communication as well. One thing I would tell my younger self is the importance of setting goals, both short-term and long-term goals. I think it's really easy for us to set long-term goals, and it can get frustrating when sometimes you don't achieve those goals in the time that you expect. So I think that's really important for both myself as a clinician and also for my patients and people who are rehabilitating from an injury to set those short-term goals to keep you motivated and track your progress and kind of give yourself a little reward when you reach those short-term goals to keep you motivated to reach those long-term goals. I found that to be something that's really, really important and something that I wish I would have known at a younger age. I think when I leave athletic training, I want my legacy to be primarily formed on my impact on my patients and student athletes. Again, I think as athletic trainers, since we get to see our patients on a daily basis, especially in this setting, in the collegiate setting, we get to work with a lot of young adults who are still developing and learning their way into being an adult and doing everyday activities and getting their life on track and deciding what they're going to do with their future. And it can be a stressful time, and I hope that my legacy reflects a positive influence on all my patients.
If you would like to recommend a colleague or yourself for GLATA member spotlight videos, you can go over to glata.org, look under the Advocacy Committee tab, and click on GLATA AT Spotlight to fill out the form. Until next time, stay great, GLATA.